day, because I don't know whether it's morning or evening or nighttime where you are, but that's irrelevant because today we're going to talk about TriCare and CHAMPVA, and it is always 24/7 time to talk about these things, okay? All right. So the first thing I want to do, just like I did the last 2 weeks with Medicare and Medicaid, is to tell you their website, because we must remember that things change, okay? And not only that, but you're learning about this now, and that's important for you to get that that uh, what's the word? Understanding of what these things are. But what I also want is when you are on the job, if you have a patient who is covered under TRICARE or CHAMPVA, you're not going to necessarily remember what I'm saying today. So I want you to remember, always go to the source. Don't just Google it and take the first whatever. You don't want other people's opinions of what it is. You want to go directly to the source, because that will protect you and make sure you're doing things correctly. Okay? So it's www.tricare.mil, M-I-L as in military. How clever is that, right? Because you already know .com stands for commercial. .edu is educational. Okay? So you see how this is all working together. Okay. So TRICARE is the facility, is the coverage. Well, okay, let's talk about this for a second more. Okay. So when you go to TRICARE, this is right now, this is the homepage. Okay. And you can see that all of these links here are all addressing the patient. Okay. But as a professional medical coding and billing specialist, you don't want to know from the patient's perspective. Now, when you look at the bottom of the page, it still is talking to the patient. Okay. But the patient may have questions for you. All right. And then we also were talking, and I'm going to tie this all in for you together in a minute. Okay. But first, we have to start with our definition. So, CHAMPVA stands for civilian, C, health, H, A, and M, medical, P, program of VA Veterans Affairs. Okay. So, this is the comprehensive health program, which the VA shares the cost of covered health care services and supplies with eligible beneficiaries. Okay, so there are two things in that description. Number one, shares the cost. So that's letting you know, as the medical billing professional and coding professional, that there is going to be some type of copay or co-insurance. Okay. And then, of course, we only have eligible. And remember, this is Veterans Affairs. So that tells me these are people who have been discharged. Okay. Now, when we compare this, TRICARE is regionally managed, active duty, and retired members of uniformed services, which covers everything, including, I think, including the park services. Okay. Their families and survivors. Okay. Now, a veteran might be eligible for either program or both. So again, as the professional medical coding specialist, you need to know which program this individual is covered under. Okay, and there's an exception, military retirees who are automatically under TriCare, and KIA, that's killed in action veteran spouses, are only eligible. My mouth made a typo. Okay, eligible for TriCare, which goes directly with the description. Okay. So, what do you need to know? The first thing you need to know from the patient is which program are your health services covered? And then you need to go make that contact to understand how to bill. Okay. Now, there are a couple of job opportunities here for you. And the first is to go work for the Department of Veterans Affairs. They hire a lot of our graduates, our coding graduates. And so it's, from what I understand from some of our alumni, it's a really good gig. Okay. And they're always expanding. So this is a good thing if you want to apply and you're in the interview, that you know the difference between these two programs. Okay. The other thing is there is also, let's see if I have it on the next slide. Here, I have it on this slide and I'll go back. Okay, which is there is something called the Community Care Network. And basically, this is an opportunity for providers outside of the VA to apply to become, for lack of a better word, like an adjunct, okay, out in the community. And then veterans in that area can come to them, and they already have that approval to bill directly into the network. And this is done for a couple of reasons. Number one, if the nearest VA facility does not provide the level or the kind of care that the patient needs, they can go to a community care provider. And the other thing, which I think is really important, is if there is not a veterans facility within 50 miles, the patient can opt to use a community care network so they don't have to travel so far to get regular care, whether it's a checkup or ongoing treatment, whatever it might be. Okay. Now, if you go on the website under community care information for providers, it can provide you with the details for a local provider to join the network. And this is a really good thing to do for our veterans so they don't have to travel so far, especially if you're working for a specialist, especially a specialist. Okay. So this is a really good thing that you can do when you get a job at a physician's office or a clinic, and you can inform them that they can be part of the community care network, especially if there is no veterans hospital or facility within 50 miles. And that's easy for you to find out. You know how you find out? That's right. You go on the internet. Okay. All right, now I want to go back here, is to remind you that in all of these cases, and we talked about this 2 weeks ago when we talked about Medicare, we talked about this last week when we talked about Medicaid. Now we are talking about it again with TriCare and CHAMPVA, and that is, remember, you are a provider, not a patient. So you have to pay attention to where you are clicking, because it's kind of like, looking at a coin. It's the same coin, but you're on the other side of it. Okay. You have to know what you need to know as a provider. The patient needs to know different things. Okay. You'll also notice here at the bottom is the link to the Community Care Network. There are resources and references and provider advisor past issues. So you can sign up, and that's this little box on the right-hand side of your slide on the screen. Provider advisor. Oh, isn't that comes trippingly off the tongue. Okay. But basically, what is this? This is going to be a newsletter that is going to provide you with information, providing care for veterans and their families. And if you are working for a provider that lives in an area with veterans, or that your patient population includes veterans, this could be very helpful. And again, remember, as a professional medical coding and billing specialist, it is your responsibility to get the provider optimal reimbursement. That means the maximum amount of money they earned legitimately, legally, properly, right. Okay. In order to do that, you have to become knowledgeable about the way each of these different third-party payers do their thing, which claim form to use, where to go to file the claim form, what exactly do they call what, where, how, I don't know. Now, of course, the codes that you are learning in class are the same. The code sets are the code sets, okay? So you're still going to use your anatomy and physiology and medical terminology to understand the doctor's documentation and be able to translate that into the appropriate diagnosis codes and procedure codes. Okay. But then there's the billing part. And that's where this all becomes exciting, because it's different. And it means you have to know who your patient population is. And you have to do right by every one of them. The Medicare patient, the Medicaid patient, the patient that's covered by Humana or Prudential or United, and the TriCare or CHAMPVA patient, because that's your responsibility as a healthcare professional. Wow. Aren't you important? And you know what? Yes, you are important. You are important. The doctor provides health care. You have your hands on the tap of the income coming into that facility. If you don't do your job right, there's not going to be sufficient amount of money for you to get your paycheck or that raise that you really, really deserve. Okay. And it's all pretty straightforward because everything is in writing. This is not something you got to go to the union hall and listen to here. It's not against unions. I'm just saying that this is something where you have literally at your fingertips the information directly from the source to know how to do this part of the job. This is your job also. Okay. And you'll notice here at the bottom of this page, Community Care Network information for providers. You have your regional networks link. If you want to recommend that your provider join the Community Care Network, that's really good. Frequently asked questions, that's always good. And contacts and resources in case you need to call somebody, because sometimes you just got to call somebody. Okay. You can do this And I want to go back and remind you, it's all online. It's literally at your fingertips to get accurate information. You do not want to embarrass yourself at an interview, much less when you're on the job, and say something and have them say, oh, we don't do that anymore. We don't use that anymore. That's not the way we do things 6 months ago. That makes you sound very unupdated. I know that's not proper English. You will forgive me. I'm just trying to make a point. Okay? And here's my other point. Do you have any questions? Any questions at all? Well, guess what? You're going to email me and you're going to ask me that question. And then guess what? Within 24 hours, I will email you back and answer your question. Okay. And you know what? I truly love it, love it, love it when students ask questions. I really do, for two reasons. Number one, it shows me that you really want to learn. But number two, it gives me a chance to teach you more, maybe in addition to what's in the textbook. Okay. And it keeps me on my toes. Oh, that would be three reasons. All right. But, as I mention every week, safiansc@cctech.edu is the email address, not the mycctech.cctech.edu, not that one. That one goes where? Come on, I've been telling you this every week for 12 weeks. It goes to the third ring of Saturn. So please do your thing. Email me, even if you just want to say, this is what I think. Is that correct? Okay, whatever. All right, it helps me feel useful. Have a wonderful, wonderful, wonderful day and stay on your toes.